First Local. Supported by Maker North, 3D printing, laser cutting, 3D design, education prototyping, and more. Maker North, whatever it takes.
Ontario is home to more than 375,000 people of Ukrainian origin, which is the largest population in Canada, many of whom live right here in Etobicoke Centre. Since the Russian invasion began, constituents have been contacting my office looking for ways to support local Ukrainian families, whether it be through donations, advocacy, or other means. I will continue to have my doors, phone lines, and heart open to all of you, and thank you for rallying together in this difficult time of need. I am proud of the work we have been doing as a government under the leadership of Premier Ford to help refugees, such as with the monetary support directly to Canada-Ukraine Foundation. Ontario's monetary support is helping the humanitarian issues like medical aid, emergency shelter, and food. Coming to Canada from Poland with my family was not easy as an immigrant family, but thanks to the community warmth, we were able to establish roots and call Ontario home while proudly honoring our Polish heritage. Poland, being the neighbor to Ukraine, has welcomed over 2 million refugees warmly into the country, offering a space for safety and hope. It has displayed the kindness and humanity that I know the people of this province will show Ukrainian refugees when they arrive. We are prepared and ready to assist those in need so that they can also find safety and hope right here. Ukraine has been through so much pain and faced so much adversity over the last 100 years with wars, invasions, and injustice. And in 2022, our government strongly condemned this war that is leading to too many innocent lives being lost and families separated. But the spirit of the Ukrainian people is not one that is easily broken. Premier Ford, myself, and others gathered here today unequivocally to stand with Ukraine, and I know the people of this province feel the same. I am proud to now welcome Premier Ford to speak. Thank you.
Thank you. Well, good morning, everyone, and thank you, Minister Surma, for that introduction. And on behalf of Minister Surma, Elliott, and McNaughton, I'd like to thank everyone here for having us today. I also want to welcome my good friends from the Ukrainian-Canadian Congress. Their bravery and dedication over the past several weeks has been nothing short of remarkable. Over the past several weeks, the world has watched in horror as the innocent people of Ukraine have been under attack by the full force of the Russian army. And while we admire the spirit of Ukrainians and the incredible defense they're mounting, we also know that a humanitarian disaster is underway. That's why our government and our federal partners are moving with no delay to get Ukrainian families out of danger zones and into Ontario through an emergency travel authorization. The people of Ukraine will always be welcome here, especially at a time when our government is facing historic labor shortages. Ukrainian applicants to Ontario's immigration nominee program are now receiving priority processing. We're also launching a dedicated hotline and email address to connect Ukrainian newcomers with local employers to help find them a job. The number is 1-888-562-4769. I'll repeat that. It's 1-888-562-4769, and the email is ukrainianjobs@ontario.ca. So if you're an employer and you want to help some really great skilled people, please go online or make a phone call. We have the jobs, we have the skills, and we want them here in Ontario where they'll be safely and warmly welcomed. But we won't lose sight of the fact that these brave people will often be coming as families, some with young kids who have just been through something that nobody should ever have to experience, most certainly not a child. And so we will have all the critical supports that these families will need once they arrive here in Ontario. Our government is investing up to $300 million. I'm going to repeat that figure, $300 million to support the Ukrainian community as they arrive to our province. I want to thank all multiple ministries. They've been working on this for weeks, and I just want to thank each and every ministry for putting together a strong plan. This will include expanded OHIP and drug coverage, emergency housing, and income support for those who qualify. We're also ensuring that elementary and high school students coming from Ukraine can attend publicly funded schools here in Ontario for free. To minimize the disruption to their education and to recognize the hardship they have just endured, we plan to offer trauma-informed counseling and other supports to students and families coming from Ukraine through a new $450,000 provincial investment in Canadian Ukrainian community organizations. To further those cultural ties, we're also establishing a new $2 million Ontario-Ukraine Solidarity Scholarship for Ukrainian citizens studying at Ontario's publicly assisted colleges and universities. And finally, our government is providing an increase of $900,000 over 3 years to the Canadian-Ukrainian Immigrant Aid Society to help that agency deliver targeted settlement services to newcomers. My friends, Ontario is home to more than 375,000 people of Ukrainian origin. The generational bonds between Ukraine and Canada run long and deep. As Ontarians, we're blessed to live in the greatest province, the greatest country in the entire world. And we're so fortunate and so lucky to enjoy freedom and economic opportunities. Now more than ever, we stand shoulder to shoulder with all Ukrainians in the fight, and will always support our friends in their time of greatest need. I want to thank you, and God bless the people of Ukraine. Now I'll pass it over to Irene Shimelo Newton. Hopefully I got that right, Irene. Thank you.
Thank you, Premier Ford. I have to have my notes with me. My apologies. Honorable Doug Ford, Premier of Ontario, Honorable Ministers Christine Elliott and Monty McNaughton, thank you so much for inviting us and for inviting me to be here. As the Vice President of the Ukrainian Canadian Congress Provincial Council, I deliver greetings and gratitude from our President Taras Bahri, who unfortunately could not be here. The Ukrainian Canadian Congress Provincial Council, all of our branches, and the Ukrainian communities from Windsor to Ottawa and from the Niagara region to Thunder Bay have been working very hard since this hideous invasion of Ukraine by Russia began to assist, to support the displaced Ukrainian families that are coming to us in Canada, to Ontario, and seeking shelter, peace, and stability. As Premier Ford said, there are over 350,000 Ukrainian Canadians living in Ontario, some who have been here 5 generations and some who are new immigrants, all extremely hardworking and ready to add to the Canadian mosaic. The UCC and all Ukrainian Canadians are truly happy to hear the announcement today because it benefits all of our fleeing Ukrainian families coming from a war-torn country. Having access to drug benefits for those that are ill, for traumatized Ukrainian mothers, children, and seniors, it is extremely important for us to hear this announcement, and access to emergency housing also makes us feel better. We are grateful that the Ontario government will offer these services, as well as access to counseling, integration supports, assistance with college and university education, and connections to employment. As we also hope that childcare is included in this for the mothers that will be working and will need care for their young children. This is all necessary to make our incoming families feel safe, secure, and able to contribute to our Ukrainian Canadian diaspora. Once again, the Ukrainian Canadian Congress is grateful to the Ontario government for having stepped up with this support, and we are ready, willing, and able to continue our work with all parties to make life a little easier for our Ukrainian war-displaced people. Thank you again to the Government of Ontario and to everyone who worked on this effort. Thank you.
Okay, we're ready to take questions. We'll be taking questions from the microphone. Just a reminder, it's one question and one follow-up.
Premier Yuri Belinsky, New Pathway Ukrainian News. What kind of emergency housing do you envisage for these people?
Well, we're working with the Minister of Housing, and any available housing, we'll make sure that we take care of people. We'll, even if it means getting hotels temporarily to house people in a safe environment, make sure that their kids have proper, and themselves have proper health care, education, and support for child care as well. We're putting every single ministry on high alert. They've done an incredible job, and they've worked very hard over the last 2 to 3 weeks. But in saying all this, depending on how many families arrive, first of all, I want to thank the Ukrainian community. They have stepped up massively right across this province, and I'm very grateful. We're going to need the support from the federal government. We're going to need support from communities and municipalities, and the province will be there as well. And not just the Ukrainian community, but everyone needs to come out and support the Ukrainian community. We're all behind them. We support them 1,000%. And depending on the amount of people that are coming, there may be a few bumps in the road, but I can assure you they're going to have safe haven better than where they were coming from.
Sure. And these income supports, they will be means tested. They, when will they kick in? Will they depend on how much they bring with them? Or?
Yeah, well, they'll go through the process. They'll go through the application, and we won't delay it. We'll make it the highest priority when they arrive here.
Thank you.
Thank you.
Hi, Premier. Actually, this is a question for Minister McNaughton. Just in regards to, from what we understand, there's about 20,000 employment opportunities that have been opened up from unions. I wonder if you can elaborate a little bit more. What unions have you spoken with, and what kind of employment opportunities, what kind of jobs could these Ukrainian refugees find themselves in once they relocate to Ontario?
Well, certainly the Premier's right. The first goal is to ensure that Ukrainians have a safe haven here in the province of Ontario. That's why we're stepping up and working across government to ensure that there's healthcare supports, education supports, social assistance to help people transition to Ontario as quickly as possible. I'm proud to say that we are working closely with the federal government. In fact, this morning I spoke with the federal minister, Sean Fraser. It really is all hands on deck to support people. When it comes to employment opportunities, we do realize that it's going to be primarily women and children coming in the beginning, but employers have stepped up. We now have over 30,000 job opportunities for Ukrainians, and this just speaks to the Ontario spirit that the Premier has mentioned so often the last couple of years, but companies and labor leaders have truly stepped up amongst all industries to offer over 30,000 jobs for Ukrainians.
Follow-up question is COVID related, if possible. Minister Elliott, I just wanted to get your a little bit more information in regards to the timeline regarding the rollout of fourth doses, and also just your reaction to the uptick in numbers, especially when it comes to children being hospitalized.
Well, for fourth doses, as you know, they're being extended to people over age 60, as well as people from First Nation, Métis, and Inuit communities over age 18. They can receive the fourth dose within 5 months of receiving their third booster dose, and they can start booking appointments as of tomorrow through the usual vaccine portal or calling the phone number, as people always have. So that's going to be really important for people to get that extra level of protection. In terms of the uptake in cases, both for adults and children, that's something that we anticipated with the opening up of Ontario to get us back to our economic strengths, and also because of the transmissibility of the BA2 variant. However, with the highly increased numbers of people having been vaccinated, with the antiviral medications coming on into a greater supply across the province, and knowing that we have the capability in our hospitals to manage this, this is something that we are sure that we're going to be able to get through. There's no cause for panic, that this was anticipated. So thank you for the question.
Hi, question for the Premier as well about the COVID situation. We've heard you talk about ICU capacity as the rationale for dropping public health measures, but why isn't the goal keeping people out of ICU in the first place, especially given what we've seen with past lockdowns that were necessary because the province waited until the health system was strained to take kind of these measures?
Yeah, well, first of all, I always take my advice off Dr. Moore, and I've taken it right from the get-go, and his health experts, and we're going to continue taking it. As Minister Elliott said, we do have the capacity within our hospitals and ICU, as you mentioned. We've seen the ICU actually stabilize. 160 people are in ICU, and what I understand, they've been there for a little while right now. But keep in mind, we can ramp up to over 3,000 beds. We've increased acute care by 3,100. We have the antiviral pills as well. We've learned a lot, and not only just the world and our country, but the health professionals. And I am very, very confident as we see the uptick a little bit that we knew that was coming, and Dr. Moore mentioned it, and I've mentioned it publicly. We can handle this. We have the resources, we have the skill set, and we'll get through it.
And I was wondering about the fourth dose plan, or the expansion your government announced today. We're wondering what the plan is to communicate about this to people and encourage uptake now that these doses are available, and we know third dose uptake has kind of stalled. Like, how do you plan to explain to people why a fourth shot is necessary, especially because Dr. Moore hasn't been speaking publicly recently?
Well, I can pass that to the Minister of Health.
Well, we're asking people who are eligible for the fourth dose to receive it, to continue to boost their immunity to COVID, and that's going to be really important to reduce the numbers of people that end up being in hospital, because if you are fully immunized, then you have better protection. If you do contract COVID, it's far less likely that you'll need to be in hospital. So that's, and we're going to have a wide public notice and public education campaign about that, in the same way that we did for the third booster dose as well.
Good morning, Premier. Do you have any sort of estimate of how many Ukrainian refugees we'll see here in Ontario?
We're hearing a guesstimated roughly 40,000. That can fluctuate, but we're ready. Well, we welcome as many people from Ukraine as possible. We got to protect these people. You know, what they're going through is absolutely staggering, and we need to open our arms, which we're doing, and we'll make sure they feel right at home, and everyone will welcome them with open arms, and I'll be the first.
Has Ontario seen already any Ukrainian refugees arriving?
What I understand, and this is through our Ukrainian community and just talking to people, yes, but a lot of them are staying with families that are here already. We have a large Ukrainian population here in the Etobicoke Centre. This is where I grew up. I was born here, a lot of Ukrainian friends. I just want to give them a massive shout out. They've been absolutely outstanding, literally giving their shirt off their back. They open their doors, welcome them into their families, but we're going to be there to support them. We'll be putting everything we have behind it, and we're investing. They gave me a total of, actually, it was closer to $390 million. I'm being conservative at saying $300 million, but that doesn't faze us. We're here to welcome the people of the Ukraine, because what I've experienced with our community, our Ukrainian community, they worked their backs off, their families. When they came here, and as Irene, you mentioned, 5 generations, they give back to the community. They always help out. They support people. They find a job. They're brilliant people and hardworking people. I welcome them with open arms, and I'd be the first to help them any way I can. Hi, Jamie.
Hi, Mr. Premier. Mr. Premier, this question comes in from Cynthia Mulligan. Premier, the wastewater shows that cases are rising. Hospitalization rates have gone up almost 40%, according to the minister. ER doctors say they've never seen so many children getting sick, yet your government seems to be downplaying it. On Monday, you called it a little spike. Your health minister yesterday said people need to calm down. Are you downplaying this
No,
wave
Jamie.
just for political reasons? Because it's
No,
really
I
easy
don't.
to draw the line.
No, Jamie, I'm not downplaying it. I've been accused as the toughest leader in North America, restrictions. We were last to pull restrictions in North America, probably the world. I'm always going to be cautious. But let's put this into perspective, Jamie. We have still the lowest cases, or one of the lowest cases per capita of hospitalizations in the country. You want to compare us to Quebec. Quebec is double the amount of hospitalizations, and we're going to be cautious. We have the supports, we have the beds. As I mentioned, we have acute care beds of 3,100. We're a population, Jamie, of 15 million people. And out of the 15 million, God bless these people, we have 160 in ICU that have been there for quite some time. Everyone has pitched in, and we're doing fairly well as a province right throughout this pandemic. And it all has to do with the great frontline healthcare workers and the doctors and communities that have pitched in.
And the next question is, the Chief Medical Officer of Health, on other waves, we're seeing quite regularly scheduled with him. He hasn't been seen for almost 4 weeks. Shouldn't he be available?
Well, let me tell you about Dr. Moore. Dr. Moore is one of the hardest working people I've ever met. He never rests. He works around the clock for the people of Ontario. And like yesterday, he had a meeting with all public health officers throughout the province. He is on the job 24/7, looking at the figures, looking at the stats, and giving myself and our cabinet advice. And he's done an incredible job from day one. And I just don't say that. I talk to a lot of people, Jamie, and he's very articulate. He understands where we're at, and I'm his biggest fan. Thank you.
Hi there. I have a question for the Minister
Sure.
of Health, please. Hi, Minister. I have a question from Matt Bingley from Global News. We're continuing to hear stories about how difficult people are finding it to get the Paxlovid antiviral treatment within the short window it can help them. Your strategy for loosening public health requirements relies on antivirals. So how quickly are you committed to addressing this issue, and when exactly will they be available in local pharmacies?
Well, we are addressing it quickly because we know that the availability of antivirals is one of our key elements in helping keep people safe. Initially, we received very small shipments, and so the decision was made to have them distributed through 26 points of access in Ontario. However, that situation has changed because we have received much larger quantities, and so they are still available through those 26 locations, but they're also available to primary care providers, whether it's doctors, nurse practitioners, or whoever it may be, that they can be in touch if they have a patient that needs an antiviral. They can receive them through the assessment centers, but we're also looking to expand access even further, potentially through pharmacies, so that anyone in Ontario, wherever they live, can have access to them quickly.
Last question.
You're detailing plans for fourth dose boosters, but about half of Ontario's population still hasn't had a third dose. Why is your strategy to drop dose intervals and lowering age groups as recommended by NACI before you focus on getting lagging vaccine rates up?
Well, we're continuing to focus on whatever level of doses people need. So we're working on first, second, and third doses to get those numbers up. But we also know that for people age 60 and older, and for people who are First Nation, Métis, or Inuit over 18, they need that extra level of help because they're more compromised. And so we want to make sure that we give the maximum level of protection that is available to anyone who needs it. But just because we're now offering fourth doses doesn't mean we're also not concentrating on first, second, and third doses as well. Thank you.
Thanks, everyone.
That's great. Thank you, everyone.